Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the FIA Group.
Well, hello there, everybody. Welcome once again to another Empowering Plans podcast with the FIA Group. I am Ron Peck, the Chief Legal Officer at the FIA Group. As always, you have in the back room, making sure everything goes according to plan, the podcast producer with the most, that is Pat the Man Santos. Hey, Pat. Also with me today, we've got one of my favorite, not just favorite FIA Group employees and attorneys, but one of my favorite human beings. Don't tell anybody else I said that, is Nick Bonds. And Nick will take a few minutes in a bit to remind people who you are, sort of reintroduce yourself to those who don't know you, and get into the meat of today's discussion. And that brings me to today's discussion, which sort of orbits around a topic that is near and dear to my heart. Honestly, sort of high level, it relates to the cost of healthcare. And for those who are sort of moaning and rolling their eyes and going, oh boy, Ron's on his soapbox again, stop it. We're going to get into a very specific chain of events that we've been seeing more and more greater frequency. That is the merger, the downsizing of the hospital industry, the market, mergers and acquisitions by some large hospital systems of smaller regional hospitals, the closing of some hospitals, forcing people to commute and travel to fewer options, these bigger urban facilities, and how that's impacting the cost of healthcare. So yeah, we're going to get pretty specific, but just to start and remind people as we get into 2024 and the presidential campaign and election season, you're going to hear more and more political rhetoric about the cost of healthcare, cost of healthcare, cost of healthcare. It happens every time. As they poll voters, you're going to hear people saying that they care about foreign policy, they care about the economy, they care about immigration, that those are the topics they want to hear about. And yet, without fail, as we get into debates and you start to hear the sound bites, more and more people are going to fall back onto the old tried and true, which is the cost of healthcare. Healthcare costs too much. And without fail, when they talk about the cost of healthcare, what are they actually talking about? The cost of health insurance. And this is something that we all have an obligation, not only as members of the health benefits industry, but as American citizens and frankly, consumers of healthcare ourselves. We have an obligation to recognize that health insurance and health benefits is not healthcare. Healthcare is the providing of care for one's health. It's that Tylenol or Advil, ibuprofen that you're taking when you have a headache or a fever. It's the surgery on your hip or shoulder when you need it. It's eyeglasses when your vision is failing like mine. It's the actual provision of care for one's health. That's healthcare. And if the cost of health insurance is getting to be too much, your premiums, your copays, your deductibles, is some of it having to do with the inefficiencies in the health benefits market and health insurance market? Sure. Are there some greedy people out there who are looking to turn a profit at the cost of you and me? Sure. Could they reduce the premiums a little if they were a little more effective or efficient in how they spent the premium dollars? Probably. But a lot, not all, but a lot of what's driving these costs of health insurance up is the actual cost of healthcare itself. And today, Nick's going to take us on a little bit of a journey to identify one of the many factors that is causing the cost of health care to increase. And as a result, the cost of health insurance is following. So without further ado, Nick, why don't you go ahead and reintroduce yourself to our listeners, remind them who you are, what you do at the FIA Group, and then let's dive in.
Yeah, thanks, Ron. My name's Nick Bonds. I'm one of the consulting attorneys here at the FIA Group. I actually just hit my 5-year anniversary, so kind of a big deal for me here with FIA. It has been a minute since I got to jump here on the podcast mics, but it's always a pleasure to be here, and especially with you, Ron. I think this will be a good talk. About 20 years ago now, there was this seminal article in the healthcare field that I think summed up exactly what you're talking about right there. The article's title really sums it all up. It's The Price is Stupid, which they actually followed up a couple of years ago now with another article basically saying it's still the price is stupid. And one of the things that consistently drives up the prices of healthcare is the primary subject that we're going to hit on today, which is consolidation and mergers and acquisitions and just the tightening of the hospital and healthcare provider market. We're kind of seeing this trend build over time. Hospitals consolidating, buying each other up, bigger hospital systems coming in and buying up smaller hospital systems, even regional hospital systems acquiring individual providers and making them a part of their broader service network. And that has an inherently anti-competitive quality to it that sort of is one of the main drivers of healthcare. Less competition means that there's less incentive for them to emphasize higher quality care. There's less incentive for them to reduce prices because they can have their prices basically as high as they want. They're playing monopoly. They're trying to buy up every square on the board and build as many hotels as possible just with hospital systems. You've probably seen a lot of that too. I know this has been kind of a bugaboo of yours for a while, Rob.
Yeah, well, actually, so for those who don't know, Nick, you're not in the Boston, Massachusetts area, correct?
Yes, that's true. I am fully remote. I'm working out of Houston, Texas, which we've seen plenty of consolidation here, I can tell you.
We got lots of listeners and friends and clients in Texas, so no shame in it at all. If anything, the rest of us should be shamed that we're not there with you. And the reason I bring that up is because, in Massachusetts, we've definitely seen an uptick in this. There are a couple hospitals. One of them was actually pretty well utilized prior to it closing. That closed due to damage from a flood. There was a major rainstorm. I don't want to call it a monsoon, but it got to that point a few years ago. This was pre-pandemic, I believe. Don't quote me on that, but it closed due to major flooding and damage. And the word on the street was, they're going to fix it. They're going to clean it up. They're going to reopen it. And they never did. And, that forced steerage of the patients who had previously been using that facility to go elsewhere. Likewise, in my neighborhood, there was a hospital that was pretty well attended, a small regional hospital. It was great, less than a mile from the house. I always thought to myself, hey, if there's an emergency, I know where to go. They ended up shutting down the emergency room, and not long after, shut down most of the services to the point that now it is just a complex of offices for different physicians, including cosmetic surgery and weight loss physicians. So this is something that across the New England region and in the Boston area, we've definitely been seeing not only some of the larger hospital systems buying up some of the facilities and then managing them, but in other instances, they purchase them only to shut them down. And in other instances, these small systems, these small hospitals, they're shut down for one reason or another without having been purchased by a larger hospital system. And so the net result is we're definitely seeing fewer options available. Now, there are certainly those out there, Nick, and I'm going to throw something out there to you. There are those out there who say, okay, well, if these hospitals are shutting down and not being replaced, isn't it true that there were just too many hospitals to begin with, right? There was an overabundance of resources. Now, we're sort of finding this equilibrium where there's the right number of hospitals for the right number of people, number one. And number two, this idea of competition certainly exists, this anti-monopoly sort of attitude that we have in a capitalist nation like the United States. It exists when there is a free market. And in healthcare and hospitals in particular, because there's no price transparency, because people don't know what things cost, it's not like they were shopping around and comparing, one hospital to another, and now they're stuck with the one that's still open. People were going to the one that was closest to them, or people were going to the one that had the nicest, free parking lot, or the one that their sister-in-law told them was a great spot, and so they went there, or the one that their doctor referred them to without really thinking about it. So I'm curious what you have to think about, do you believe that these hospitals closing, if there was no real price comparing or healthcare consumerism in the first place, why is it that the downsizing or sort of monopolization of hospitals, why is it still impactful despite the fact that maybe there wasn't that same level of shopping around and capitalism and free market that you would see in other industries?
I think you're absolutely right that there was not the same level of people shopping around and looking for the best cost to care ratios at the hospitals near them. A lot of times people do exactly what you were just saying. They would just go to whatever hospital their doctor might refer them to, whatever hospital their sister-in-law maybe says has the best parking lot or is closest to a Chick-fil-A or something. I think that the problem with this sort of monopoly behavior and hospitals consolidating and closing locations and making fewer options available is that the more that happens, the less there's even a possibility of people being able to shop around and find the hospitals that offer equally good, if not better, care for lower costs. And one of the things we've been seeing lately, employers have been trying to address this at least a little bit, is thanks to the price transparency rules that have been in effect now a couple of years. We've seen employers taking some of the data that is now legally required to be available to them and using some of the tools that are available to them and things like the NSA and the Consolidated Appropriations Act, using some of the tools that those federal laws made available to them to actually shop around, to actually find the providers that are offering the highest value for the lowest cost, the providers that are more affordable and still have a high level of care for patients and that offer the best option to employers. And those are all things, I think I threw a lot of buzzwords out there for you, but I'm one of the consulting attorneys on the PGC side, on the ICE team. If anybody listening to this does have questions or want to dive any further into any of those services, you can always reach out to us, please. We're happy to break down how any of those things work and how they can help employers in the healthcare space.
You know, Nick, I'm really glad you brought that up because as I was talking about sort of the issues with the hospitals, lack of competition, and how the elimination of some may not be quite the same as, for instance, when all the borders closed, the only bookstore in town was Barnes & Noble, right? And my options were cut in half. And did I used to shop around when it came to, buying a new hardcover or, a Blu-ray at the time, right back when we actually used it? Yeah, I did. But with hospitals, it wasn't the same. And yet, you're right. Whatever degree of cynicism that you're applying to your assessment of the situation, and trust me, a healthy dose of cynicism always settles well with me. I think that certainly there was the belief that as these price transparency rules were rolled out and some of the other things that we're dealing with, for instance, like the No Surprises Act, where providers are being forced to sort of negotiate and justify the balance when they're looking to get something additional. And all of these things that are sort of pulling back the covers and starting to expose things. I think you're right. I think some of these hospitals are sort of heading it off at the pass before it could even get to be competitive, like the bookstore example. Let's eliminate the competition before they even are competition. That's one thing that I think is very worrisome, and I think you nailed it there. Another thing to think about how this is going to potentially impact us relates to networks, right? And for better or worse, still the predominant attitude out there right now is that having a network, being in network has value, right? From a plan participant insured perspective, you want your provider to be in network, right? That's saying out of network is, woo, it gives you the chills. You don't want your provider to be out of network. That's the worst possible thing. It means it's not covered, right? That's what people think, even though they're wrong. And as a result, everybody is really sort of clinging to these networks. If you don't have a network, don't talk to me. And the problem is that a network ultimately, whether you're the payer or you're a network administrator from whom the payer is renting network access, you're a large carrier who owns your own network, whatever it is, when you're negotiating with these hospitals, with these providers, one of the values that you bring to the table, one of the things that you use as a negotiation sort of cookie at the table is steerage, is the fact that, hey, look, by you being in network and that other facility down the road being out of network, we're going to proactively push and incentivize plan members to visit you as the in-network provider as compared to the out-of-network facility. And the problem is that now if that out-of-network facility is closed and there's only one player in town, that concept of anti-competition and monopoly, it may have less of an impact on patients who really never shopped around in the first place, and may actually have more of an impact on these networks who can no longer use that concept of steerage, right, or showing preference to one provider over another. I mean, frankly, PPO literally stands for preferred provider. Well, if there's only one provider in town, what are they preferred over? I worry that it's going to have more of an impact there, where as we see the cost of healthcare go up, we see the discounts, which frankly aren't always the best anyway, those are going to go down because the negotiation power on the part of the payer and the network administrator is being reduced as the number of hospitals that may potentially be a part of the network is reduced as well. Any parting thoughts either on that or anything else as far as the trickle-down effect of what we're seeing there?
No, I think you kind of hit all the main issues. The one thing I might add too is that one of the tools we've seen people actually managing to take advantage of is the gag clause prohibition requirements, which is effectively just prohibits networks from putting in their contracts with payers that they can't disclose or reveal what some of those network discounts and what the value add of network access actually is. A lot of the people we work with and the employers we work with have been finding that, oh man, these pretty much every network and provider agreement has some form of overly broad confidentiality clause or disclosure limitation that creates essentially a gag clause. And I think now that employers will have some tools to push back against those kind of clauses, they might have a few more rounds in their clip if they want to try to fight that kind of illusory steerage, the illusory network discount. It's kind of the result of this type of provider consolidation.
Whew, it's a lot to think about, you know. I think that as we as an industry start to witness these changes that are taking place in the hospital industry, the time is now to really start looking at other tools and methodologies, because frankly, if the market from whom we're purchasing healthcare is changing and the net result is going to be an increase in the cost of that healthcare, you know, just increasing premiums, deductibles, sort of shifting the burden onto others, at some point you're going to hit a breaking point. I think we're probably just about there if we aren't already there. And what that means is maybe this overdependence on networks needs to come to an end. Maybe the time has come to really sort of shopping around as a payer, not as a patient, but as a payer, to find those facilities that are willing to provide the best quality care for the lowest cost, even if it means people need to travel occasionally, and incentivizing people to travel. That concept of specialized medical tourism, domestic medical tourism, I think that as the local market shrinks, the market that you are willing to purchase from needs to expand. And it may be that the time has come to endure a little inconvenience in exchange for some substantial savings. So definitely reach out to the FIA Group, reach out to our FIA Group consulting team, reach out to Nick. They're helping plans develop and implement programs like those and others, making sure all the pieces are in place properly, that you're staying within the regulatory guidelines set by law and otherwise. And stay tuned as we continue to dive into this and other similar topics, both in our podcasts and webinars. But in the meantime, we're out of time, and it was a pleasure spending this time with you. So once again, on behalf of myself, Nick, Pat the Man Santos, the entirety of the FIA Group, our industry, thank you once again for joining us for another Empowering Plans podcast with the FIA Group. Be well, take care of each other. So long.